The government will vaccinate more than 1 million healthcare workers and essential providers against COVID-19 from next month. The administration of the vaccine, which is set to begin in February next month, will be done in 3 phases.
We plan to start with this initial rollout for the next 18 months. The vaccination program will be divided into 3 phases. Phase 1, Kenya has prioritized the vaccination of 12.5 million people between February and June 2021, when it is expected the global vaccines that is 1.25 million people between February and June 2021, when it is expected the global vaccine stocks will be limited. The people that shall be covered in phase 1 will include the frontline healthcare workers and all staff that are working in health facilities, both in public and private sector. We have also prioritized for phase 1 to also look at workers who are undertaking essential services in priority sectors like security and immigration.
Health Chief Administrative Secretary Dr. Mercy Mwangangi said the government is developing infrastructure in preparation of the vaccines in which it will heavily depend. Healthcare capacity will also be built to ensure smooth administration of the vaccine.
We've looked at our infrastructure when it comes to vaccine. We've looked at the central storage facilities in Nairobi for vaccines, requiring maintaining of cold chain between -20 degrees. And we found that we do have some limited capacity when it comes to -70 degrees in some areas in the country. We are continuing to develop this infrastructure, remembering that we'll be leaning heavily on the infrastructure that already exists, particularly when it comes to immunization of children below the age of 5 years.
The vaccines will be a mix of AstraZeneca, Pfizer, Johnson and any other that will be included in the COVAX facility.
The Ministry of Health also intends to build a capacity of more than 23,000 healthcare workers, including 8,000 health volunteers in the area of vaccine administration, logistics management, data capture, reporting and monitoring. So this in essence will form a new frontline team that will be working to ensure that the COVID vaccine is available to the priority groups that have been identified.
CAS Mwangangi assured that any vaccine that will be used in Kenya has undergone trials to ensure it is safe.
The government has set up a safety and monitoring system. And this system will ensure that the vaccine that you receive is safe. It will ensure that the vaccine that you receive has undergone the necessary market authorization procedures and that you're able to get it without any adverse effects.
In phase 2 of the vaccination, which is set to kick off in July and end in June 2022, 9.7 million Kenyans will be vaccinated. In 18 months, 16 million Kenyans will have been vaccinated. The government said it will target mostly people aged above 50 years and those above 18 years with underlying conditions. Mombi Wambogo, K24, The Loop.